I'm Dr. Frita, and today we're talking about Princess Kate's update. She shared that she has completed her chemotherapy, and her transparency, her sharing her story, is going to touch the lives of millions. We all remember when Princess Kate Middleton made that shocking announcement that she is living with cancer. Well, now she's gone through her treatment, she's completed the chemotherapy, and guess what? She has shared it with us in a video. She's allowed us to peek into her life, and she's really been much more transparent than you normally expect the royal family to be. And I really believe that she's doing it in order to help others. And so I want to join her by just talking about cancer in general. We'll talk about some early warning signs of cancer, symptoms and signs that you should look out for in yourself or in a loved one in order to catch cancer early. We'll also talk about chemotherapy and the toll that it can have on one's body. While we don't know the exact chemotherapy that Princess Kate had, we'll talk about some of the general complications that people can have from chemotherapy, just to give you an idea of just what soldiers and survivors, people who go through chemotherapy, really are. Lastly, we'll talk about action steps. We'll talk about the importance of screening and early detection in order to improve survival if you have cancer. So please go ahead and like this video and share it with the people you care about, because I'm about to give you some important information on cancer, chemotherapy, early signs and symptoms, and the importance of screening and early detection. Keep watching. Would you like my undivided attention as we discuss your specific medical journey? If so, you are in luck, because I offer a concierge telehealth service where you can get my direct input on your health concerns. Be sure to click the link below. I'm Dr. Frita. I'm a medical doctor who has received multiple board certifications here in the United States. I've been board certified in nephrology, which means I'm a kidney doctor and a high blood pressure doctor. I've also been board certified in internal medicine, pediatrics, and obesity. So I love to learn a lot about a lot of medicine, but even more importantly, I enjoy sharing my knowledge so that you can live a healthier, happier life. Right here on this Dr. Frita YouTube channel, we now have a new community. We have a membership community where I give you a little bit of extra perks. If you join our membership, you will get access to videos that only members have. You'll be the first to have access to certain videos, and there'll be other videos that are going to be members only forever. Also, you'll have access to a monthly live Q&A where it's just you and me, members only and me, where we'll have a live interaction and you can ask me all kinds of questions about your health and about medicine. Yes, that's a members only perk. And then we'll have fun stuff like loyalty badges, custom emojis. I'll give you shout outs. It's going to be a lot of fun. Just a few extra perks. Now, don't worry. If you're someone who's been enjoying my videos, I'm still going to give you all of the great content that you love. I'll give you the evidence-based medicine. You know I'm not going to leave you out. But if you want a little bit extra and you want that kind of more personable time with me with those members only conversations, then go ahead and join. Click the link in the description. I promise you, we're going to have a good time. So yes, Princess Kate Middleton has shared that she has completed chemotherapy. And she said that life can change in an instant, which is really important. You know, when we look at the royals, we look at them as being, over there, and they're, in a lot of ways, they have to be just so very buttoned up, very put together, almost like this unrealistic perfection, except for the paparazzi's always kind of snapping and trying to catch them being imperfect. But, you look at Kate Middleton, Princess Kate, and she's tall, she's thin, she's a very beautiful person, what a perfect seeming life with her 3 kids, her husband, who's the future king, all of these things, but she's still human, and life happened to her. And like she said, life can change in an instant because she was diagnosed with cancer. I know she did share initially that she had an abdominal cancer. So let's just talk about cancer symptoms and signs that may appear that you want to look out for, especially with, some of the abdominal cancers and with some of the common cancers. So unintentional weight loss. A lot of people with cancer will start dropping weight, even if there's someone who's been dieting for years, all of a sudden the weight will be dropping off, and it's not on purpose. So unintentional weight loss can be one of the early symptoms of cancer. You can also have abdominal pain, abdominal bloating. This can happen with all kinds of cancers, be it ovarian cancer, cervical cancer, be it a liver cancer, stomach cancer, intestinal cancer. But sometimes even the abdominal cancers are painless. But certainly if you're having abdominal pain, that's something to look out for. If you're having a back pain or a flank pain, that could be indicative of something like a kidney cancer, or it can be indicative of a cancer that has spread to the bones. For example, a cancer that spread to your backbones or to your vertebrae could be causing a back pain. Or if it spread to the ribs toward the back, that could be a metastatic cancer, and that could be indicative. So that could be a symptom. Also, if you get jaundice, which is when you get a yellowing around the eyes or even a yellowing of the hands, yellow skin, yellow under the tongue, this could be indicative of a liver cancer. It could also mean that you have some type of a blockage in the biliary system. So it could be liver cancer, but it could also be pancreatic cancer. It could be a gallbladder cancer, or it could be a cancer that spread from another place to the liver or to the gallbladder system. Okay, so jaundice could be one of the symptoms of cancer. You can also get fatigue. And I know that's nonspecific because a lot of things can make us tired. But if you just have an extreme tiredness, even when you get a good night's sleep, you have extreme tiredness or fatigue, yes, that could be a symptom of cancer. Other symptoms of cancer, clearly, if there are masses or bumps or lumps that you detect. So, for example, masses or lumps in your breast. So certainly you want to do self-breast exams, consult with your doctor, and make sure you have age-appropriate cancer screening, like your mammograms. Again, consult with your doctor. You also want to check for lumps in your underarms or your axilla, because for breast cancer, you have some breast tissue that extends to your underarm. So that could be one of the signs or symptoms of cancer. If you have changes in your bowel or bladder habits, so for example, if you have bloody urine, that could be a symptom of bladder cancer. It could be a symptom of kidney cancer as well, right? Or if you have abnormal bleeding, like abnormal menstrual bleeding, okay, bleeding between periods, or even after you've gone through menopause, now all of a sudden you're having vaginal bleeding. That could be a symptom of cervical cancer or uterine cancer or even endometrial cancer, right? And then the abdominal bloating I mentioned, that could be a lot of things, but ovarian cancer could be in there as well. Changes in bowel habits, if you are very constipated, or if you're having diarrhea, certainly if you have bloody stools or bright red stools, that could be a symptom of a colon cancer. So really just pay attention to your body and respect the symptoms of your body. Go to your doctor if you're having any of these signs or symptoms. And even if your doctor says, oh, you're probably fine, or maybe you're just having a little indigestion, if you know your body and you know that these changes are really worrisome, keep going to that doctor or even seek a second opinion. Ring the alarm. If you know something's going on with your body, make sure that you are your own advocate and speak up for yourself. So now let's talk about the toll that chemotherapy can have on one's body. Princess Kate shared that she has completed her chemotherapy and she looks pretty good, pretty happy. She's laughing with her family. But let's not forget, if she's completed chemotherapy, she's been through a lot. So yes, chemotherapy is one of the treatments for cancer. But in order to treat the cancer and kill the cancer cells, that means it kills some other cells as well, which can lead to a lot of complications, okay? So what chemotherapy does is that it kills rapidly dividing cells, right? Which is what cancer is. Cancer is when you have cells that have abnormal growth and they keep rapidly dividing. They grow until they grow outside of the organ from which they originate, and they start invading other tissues, and they eventually can take the life of a person if they're not controlled with things like chemotherapy. Well, while chemotherapy kills cancer cells, it can kill other cells. For example, hair cells, right? And so it can cause hair loss. And you know that for anyone, but also particularly a young woman like Princess Kate, who's in the public eye, if it causes thinning hair, then that can really, affect your self-esteem. It can affect your mood, especially when paparazzi's all around. So for many people, it can cause a thinning of their hair. Her hair looks great. So I don't know if she's had to deal with it or if she's got great hairstylists or if she's just been really blessed. But for my patients, a lot of them lose their hair and they feel vain by complaining about it, but it's not just about vanity. It's about how you feel. It's about not wanting to be depressed, and so it is a big deal for people when they lose their hair, particularly women. And so it's okay to be upset or annoyed if the chemotherapy takes hair. And it is a toll that can really, affect your psyche. Other things that chemotherapy can do, it can kill the cells that are in your stomach or the cells that are in your intestines. And that means it can cause diarrhea, a really loose diarrhea. And so you can be out in public and trying to kind of go out and deal with life, and you might get diarrhea out in public, and you may even not quite make it to the restroom. And so it can be humiliating and make you want to just stay at home. And so that's another toll. It can affect your socialization. The other thing that chemotherapy can do is it can decrease your appetite. So while, yes, cancer in and of itself can cause an unintentional weight loss, well, so can the chemotherapy. It can make you not want to eat, which in turn can make you have a poor protein intake. It can make you lose muscle mass. It can make the collagen in your skin be insufficient. And so you start getting a saggy face or a gaunt face or look older than you normally look. And that's another way that chemotherapy can have a toll on you. Chemotherapy can also affect your blood cells. It can make you anemic, which can lead to severe fatigue. It can wipe out your white blood cells, which are cells that help you with your immune system, help you to prevent infections. So if you're on chemotherapy, you can become vulnerable or susceptible to infections. And so you're taking the chemotherapy to not be sick from cancer, but being on chemotherapy can increase your risk for infections and make you sick. So it can really have a huge toll on you. So while we don't necessarily know the specifics with Princess Kate, we do know she's completed chemotherapy. And so it's very possible that she's had to deal with the tolls of chemotherapy on her body and her psyche. Oh, chemotherapy can also cause nausea and vomiting, which we know can further weight loss. And have you ever been nauseated? Of course you have. Being nauseated or having stomach symptoms or diarrhea, there aren't many things that are worse than that. But chemotherapy can cause patients to be nauseated and have diarrhea for months and months on end. That's tough. And then it can also affect your brain. Chemotherapy can cause you to be forgetful. It can give you chemo brain, which is another one of the tolls that it can have. So now let's talk about the importance of early detection, right? The importance of early detection of cancer. We can't always control life, right? We can't control if we get cancer. You can be living the perfect life with no smoking, no drinking. You can exercise, drink water. All of these things can help you to be healthier, but there's still no guarantee. Oh, and make sure that you click the link in my description because I have a freebie for you. If you click the link in my description, you can download a free PDF on 10 healthy habits for a better you and a better life. You'll love it, and it will make a difference in your life. I guarantee it. These are habits that I check into in my day-to-day life to help me live my healthiest, happiest life. But back to the importance of screening and early detection. Let's just go through a few of the cancers that we actually do have screening for. And I've already touched on some cancers where I talked about some of the signs and symptoms, but we'll hit on a few of those. Okay, so it's dealing with abdominal cancer, specifically with women, there's cervical cancer. Well, yes, some of the signs and symptoms can include some pain, like pelvic pain, fatigue. You can have vaginal bleeding, things of that nature. We do have screening. We have the pap smear. So consult with your physician and find out the age that's appropriate for a pap smear and for a pelvic exam in order to prevent. And I've had patients who've had, various pelvic cancers, and they've gone and they've complained to their doctors, oh, I've got abdominal pain, oh, I've got problems. And in some cases, particularly with the patient I just saw this week, she happened to be someone who's living with obesity. And for 2 years, she kept being put off and told, oh, just lose weight. Oh, maybe you have a UTI, or urinary tract infection. She was given antibiotics, but she kept complaining. And as it turns out, even after 2 years of complaining, what they found out is that she actually had ovarian cancer. And you've probably heard the other story of that influencer, Jessica Petway, who died in her 30s just recently. She had cervical cancer, but she was misdiagnosed. So I say that to say that, again, even when you go to your doctors and you have your complaints, make sure you push as far as being screened. Or if they keep shooing you away, go get a second opinion. Take someone with you to advocate for you. So Just be your own voice. And, doctors are not perfect. Sometimes doctors have biases. Sometimes they just miss it or get it wrong. But it's important for you to advocate for yourself. So yes, for cervical cancer, we have pap smears. But for another one of the gynecological cancers, ovarian cancer, we don't have a routine screening. So you have to pay attention. Are you having abdominal pain? Are you having abdominal bloating? And you can simply ask your doctor, hey, do an ultrasound, do a pelvic ultrasound, do a vaginal ultrasound. Check me out for certain cancer markers to see if I have ovarian cancer. It is your right to advocate for yourself. There's also uterine cancer, and your physician is able to do, imaging or do a uterine biopsy if necessary. We don't do routine screening for uterine cancer. There's also endometrial cancer, but again, you must advocate for yourself and pay attention for symptoms. In the abdomen, let's see, we also have colon cancer. We do have routine screening for colon cancer. So by the age of 45 is what's being recommended by many societies, where you can get a colonoscopy. There are also some genetics testing that can be done, but quite frankly, the colonoscopy at this point is the standard of care. By 45 for many, especially if you're a Black person, because we know that Black people tend to get diagnosed with colon cancer at earlier ages and with more aggressive forms. So yes, so cervical cancer could be as early as age 18. Consult with your doctor for the proper time for screening with a pap smear. Colon cancer is a colonoscopy. 45, but if you have a family history, or if you have something like familial adenomatous polyposis, like some type of a genetic condition, you may need to get screened for colon cancer even earlier. Consult with your physician. And then there could be liver cancer. You could be at risk for liver cancer if you drink excessive alcohol, if you've had inflammation of the liver, if you've had hepatitis B, hepatitis C, if you have a fatty liver. There are different things that can put you at risk. And while we don't have routine screening, if you're having pain, especially in the right upper side of your abdomen, or if you're having abdominal bloating, if you're having veins sticking out in your stomach, if you're having blood clotting disorders, if you're having vomiting of blood, if you're having jaundice, these could be some of the symptoms of liver cancer. But pay attention, talk to your doctor. Imaging is something that could pick it up. We know we just lost Mariah Carey's sister to liver cancer. Again, there's no routine screening, but if you're having symptoms, then you go to your doctor, you push and you ask. Gallbladder cancer is one of the abdominal cancers. It's more rare, and it can have different symptoms. Again, unintentional weight loss. You can have jaundice. You can have pain in that right upper side of your abdomen. You can have small intestine cancer. There's no routine screening, but again, you can have bloody stools with that. Imaging would be able to pick it up. You can have weight loss, nausea, vomiting, all of those things. Stomach cancer. If you are someone who's had H. pylori, or if you're someone who's had frequent ulcer disease, that could be something that could put you at risk for stomach cancer. And with stomach cancer, you can have early satiety, meaning you get full really quickly, okay? Or you can have, again, the weight loss, vomiting up of blood. There can be imaging studies that can pick up if you have a mass, or you can also actually have a procedure done, an EGD, okay, an endoscope, where they can look for the cancer. But if you're not suspicious, if you're not paying attention to your body, then it may never get picked up. Be your own advocate. You know your body. Push if you are suspicious for these things in yourself or a loved one. Esophageal cancer can happen. Your esophagus, that tube that runs from the throat down to the stomach. Again, you can get, it can feel like food is getting stuck, right, when you swallow. Now, there are benign conditions that can cause that, right? Schottky's rings, or you can have a benign tumor in the esophagus, but an esophageal cancer can do it as well. And if you're someone who has chronic GERD, okay, gastroesophageal reflux, heartburn, that could put you at risk for a cancer of the esophagus. So if you have really bad heartburn, and then you're having other symptoms in your esophagus, the weight loss, vomiting of blood, feeling like food is getting stuck, it could be cancer of the esophagus. Look out for that. And then what else? Kidney cancer. It can present as blood in the urine. And you can also have unintentional weight loss. If you're a cigarette smoker, that can put you at higher risk for kidney cancer. It's not always painful. Oftentimes cancer is painless. But certainly if you're having blood in their urine and you want to talk and ask, there's imaging that can be done, and also some urine cytology, meaning they check your urine for cancer cells. What else? Bladder cancer. You can have bloody urine. There are ways to check for that. They can do a cystoscopy, where they literally look up your urine hole, or the urethra. They go up through your bladder. They can do imaging, a cystoscopy, where they look and they do some biopsies. These are some of the kind of common abdominal cancers I just hit on. Pancreatic cancer. Oftentimes, you don't have symptoms until late, but again, you can get weight loss. You might have stools that are pale, okay, or really fatty stools. You might get jaundice, the yellow eyes with pancreatic cancer. We know that Aretha Franklin had that. We know that Patrick Swayze had pancreatic cancer. And yeah, that's a tough one, the pancreatic cancer. But pay attention to your body. There's imaging that can be done for that. So I just want to run through some of them. We know about breast cancer with the mammograms as early as the age of 40 for just the typical recommendation. But again, if you have a family history or if you've detected a lump, then you may need to get screened earlier. So if you have a first-degree relative like a mother or a sister or a brother, because men can get breast cancer too, if they've had breast cancer, say you had a mom who got diagnosed at 35, well, it may be recommended for you to get screened, for you to get your mammogram at 10 years earlier than that, so at age 25. Okay, so these are just some of the cancers. Again, we don't know the cancer that Princess Kate had, but that's not the point. I just want to take her sharing and her transparency and her touching their lives. I want to jump and make sure that I join, and from my perspective as a medical doctor, give information that perhaps can, make a light bulb go off in you, where you pay attention, you get some early screening, some detection, or you share this video with loved ones so they can be sure to look out for cancer potentially in themselves. So now for the road ahead. Princess Kate has completed her chemotherapy, but that doesn't mean her journey is over. There's probably surveillance she has to have to make sure that she is completely cancer-free. There's always the fear of, will it come back? Are my children at risk? Is my sister at risk? Is my mother at a greater risk? My father? There's a lot physically and mentally she's going to have to deal with. So we certainly are going to wish her warm wishes, keep her in our prayers. I hope you found this information to be helpful. And if you did, please be sure to like this video, share it with the people you care about. And again, make sure that you subscribe to my YouTube channel and hit that notification bell, because I'm constantly giving you evidence-based information. And so if you hit the notification bell, you'll be among the first to know when I release this new information. As always, I thank you for watching. I appreciate your support, and I want you to do your best to live your healthiest, happiest life. I'm Dr. Frita.